Hello, I'm Jerry Clayton, Washtenaw County Sheriff, and welcome to this episode of Beyond the Badge. This episode will focus on the public safety mental health millage that was passed by the residents of Washtenaw County in November of 2017. We want to make sure that you understand the significant return on investment that we have planned for utilization of these millage dollars. To that end, I'd like to welcome our Executive Director of Washtenaw County Community Mental Health, Trish Cortes.
As you and I talked before, right now we kind of found ourselves with this perfect storm situation here in Washtenaw County, and I think we're not unique. There is a national and local epidemic around the use of opioids. We have lost capacity in our community to actually provide mental health services for those who have more severe needs. And tragically, we also know that our suicide rate in Washtenaw County is growing rapidly, particularly with our youths. So I think with all of those factors, there really has been almost a demand out of our community to do something about it. And I think with the youth suicide, with all of this, is that this is not particular to any one particular demographic or one geographic area in our county. And I think that's what's really resonated with individuals, is that suicide can impact, doesn't matter where you live in Washtenaw County, it can happen to you or it can happen to your loved one.
You know, that's a good point. Same thing we see with the opioids, right? So the opioid epidemic has infiltrated all of Washtenaw County, all 720 square miles, all socioeconomic demographics. There has not been a group that's been immune to it. And I think, again, that resonates with the larger community. And in the meetings, just as we heard from people looking for answers around the suicide for our youth, also for the opioid. They asked us, what are we going to do? And you remember our response is, what are we going to do? And so we knew we couldn't do it with our existing resources. So when we started talking about what a millage would look like, a public safety mental health millage, you know, there are a couple of things that we wanted to highlight, right? And one of the first things we wanted to say, at least, especially to the folks that are going to vote for this, that an investment on the front end is going to save us dollars on the back end, right? So we know in the Washtenaw County Jail, it's $135 a day to have someone incarcerated in our facility. But if we do an assessment and that person's not a risk to the community, and we can get them out and then connect it with mental health services and other services, even while they're going through the court system, community corrections can manage that person outside of our jail for $35 to $38 a day. So that's almost $100 per day savings that we can achieve in Washtenaw County if we invest our dollars strategically and really diverting those folks from coming into the jail. Again, we're saving those dollars, and it's the right thing to do. But we also know that regardless of our best efforts, some people are going to end up in jail. So how do we best manage those folks that are in jail? And we're in discussions about setting up a mental health unit inside the jail that is sort of co-staff, right? Sheriff's office staff, mental health staff.
Under Sheriff Clayton and Director Cortes' leadership, we've done an excellent job. With this additional capacity, we'll build on those successes, and ultimately, it's not just taxpayers who will benefit from them. It will be the individuals that we keep out of the wrong system for them and put in the right place to get the help they need that will really see the biggest benefit. On the individual level, it's hard to overstate how much this can impact a human life. If you are in crisis, if you are in a spot in your life where you are in need of mental health services, it can literally be the difference between life and death.
I think it's important for everyone to remember that this is a 8-year millage, and right now the need is so great on the mental health side that what we do in the first couple of years of the millage might look different as we continue to build capacity in the community, address some of those needs, and it will likely evolve over time. We've had lots of input from the community. We've had over 200 residents just in 5 meetings give some input on the mental health side of things. And we plan on continuing to do that process year over year to continue to hear from the public of what is it that's high priority for them.
So the millage was the people's part. Our part is to come up with the right strategy, make sure it's reflective of our community's values and what we have prioritized. And then the big thing is for us to implement and make sure that there's significant return on investment of those millage dollars.
I really want to thank you for the leadership and the dedication that you've provided. I find myself to be a very fortunate executive director of CMH in this partnership, and that you've really taken on mental health as a really important issue that needs to be addressed from the lens of law enforcement. So thank you.
Well, you know, I'll give that back to you, Trish. Our partnership is really, really strong. I think our organizations work together because as the leader of CMH, you and me have found that it's really where we're trying to go that's most important, not how we get there. So your leadership with CMH through all the challenges that you guys face to get us to the point where we could put a public safety mental health question on the ballot and get it passed is tremendous. And to that end, we want to thank the people of Washtenaw County for your confidence, your commitment, and really showing what makes Washtenaw County a very, very special place. I love this job.